we think that we should to talk about that issues.
No, I agree with you. There has to be concrete from the businesses. I don't know about the entrepreneurs who are sitting here, but most of the businesses are based out of US and they fall under the jurisdiction of US laws than Indian laws, because there are no set protocols in India, and India, it's been said that government never protects you, even if you are innocent. So that's the reason people are more comfortable setting up a business in US and putting a website here which caters to the Indian population as well.
So let me just comment on that as well. So firstly, I hope that example never comes true, but of me getting a heart attack and diabetes, etc. But but I think online.
Regulatory authority.
Yes. Yeah, we have a regulatory authority which defines all the protocols. We have an HON code, which is Health on Net code, where all the information which you actually host on the website has to pass through an HON code. If the HON code is not given to your website, that means the information is not tested and validated. So there are regulatory bodies, there are guidelines, but it's not that precise, taking every case into consideration.
So the point I was trying to make was that I think in healthcare on internet and mobile offers a lot other than seeking perfect cures online as well. So healthcare is the largest searched vertical on the internet, right? The largest number of searches of any other vertical, of any vertical, is in healthcare globally. And I think globally people use the internet to help them make more educated decisions about the healthcare that they are seeking. So whether it is a consultation with a doctor online, which forms part of the decision and the further course of treatment that they will seek, or let me give you a simple question. Like, a lot of us here are part of the healthcare industry, but for someone who's not, and that person may be in a major city as well, God forbid there's someone in the family who, let's say, has a neurological disorder, right? So sitting here right now, how many of us would truly know, if we were not in the healthcare industry, what is a good hospital, who is a good neurologist for that particular condition, where are good facilities available, and who should you be seeing, right? And those are the sort of things for which, obviously talking to friends and family is one, but portals such as ours provide you scientific information and data, not advice, mind you, but data and actionable information that you can use to figure out what is best suited for your scenario.
I would like to quote an example. Fortunately, Dr. Ratan Kelkar is with us here, and he is the chief of Kerala IT mission here, and a very good example from their side has been Dr. SMS facility, where people can actually know which establishment to go through when you are suffering from certain kind of a disorder or a disease. And it's basically a VAS-based service, so you have to just send a keyword and it gives back addresses like what we get in Just Dial or something of that sort, but it's very well thought through, kind of polished approach in terms of data collection, and it's been made in such a format that everybody who resides in Kerala, in even I think now there are 10-15 more areas in and around Kerala which are also a part of the system. They can only send a message and they will get to know the list of offers, list of government establishment, private establishment where the treatment can be carried out. And as I said, that if this can happen if one person on moon proves that people can be sent on moon, same way that this can happen in Kerala, this can also be adopted all across India as well. If Dr. Ratan Kelkar will not mind, I would request him to say a few words on this. Can you please pass on the mic, please?
Just a small initiative which we started in Kerala. It's called Dr. SMS, where a person, if he's having some kind of an illness and he wants to get some kind of reference to a particular doctor, maybe a ENT or a heart surgeon, he just needs to send an SMS in a particular format. And once he sends it, he gets, and also at present we have a small pin code of the particular area from where he's sending the SMS. Once he sends that, we'll give a list of the doctors, particular doctor he's looking for in that particular area where he resides. So that is what we have done now. But we are now trying to integrate this to the GPS so that he need not send that code. So he need not send the code anymore, the local pin code. He can just send an SMS in a particular format, and he'll be able to come across any doctor he wants. He can choose his doctor. And he can go visit and take the consultancy. That is the first stage where, the first pilot which we started. Subsequently, We have rolled it out throughout the state now, and now we are integrating this platform to another mobile service platform which we have developed, wherein we will be having more of the kind of services which Dr. Ganapathy was mentioning. We are planning to come out with the vaccination alerts and maybe to some extent also try to address some of the M services which has been discussed here. So this maybe in a couple of months we'll be able to come out in a big way. But all said, this kind of seminar not only helps bureaucrats understand what's happening elsewhere. And just a quick comment on the question which was raised by one of the doctors here relating to data mining and how the private sector is trying to grab hold of all the customers in the rural areas. I would like to put it across in another way. See, in the government you need such kind of an advice, and also I would see a good kind of a marriage between the private and the public sector, wherein we get across the right kind of an expertise to suit some of the models which we can develop and try and address some of the health issues which is happening now in the rural areas. And as far as some of the initiatives here are concerned, if we have a very good model, I think the state governments would be putting across, will be coming forward to tie up with any of the private sector unless the government is likely to be exploited. We can arrive at any kind of a model which will work out for the people in the rural areas. And I don't believe in a concept where IT needs to come at the end, because many of the solutions are offered by IT. And the kind of education which she was mentioning could be done through the use of computers. So these are the kind of things we need to have a better kind of a thought process happening here and a bigger vision, and try to work in association with the private sector and ensure that some of the things which we are not aware of in the government, we can have a very good relationship with the private sector and try to push forward some of these good initiatives. And in IT, it's not the technology. Basically, the people need to change, and people need to grow up and try to understand that this is just a tool to facilitate themselves and try to come on to a different level of thought process. So this, we should not keep this as a rich man's tool. IT is basically for the common masses, and with the kind of national e-governance initiatives which are happening across the country, I don't see in just a matter of time that all of these services will reach the common person.
Okay, just to add to that, it's interesting that you mentioned the use of technology in various areas. It's not just an elitist tool, as we would believe. So we are actually working with a government hospital in Karnataka, and basically we are using this, SMS plus a smart card and plus the PHR to actually track HIV plus positive patients. So what happens is, in many cases, the people actually go there. Once they are detected, they have to actually continuously go for treatment. If they don't, it's not just bad for them, it's also bad for the rest, because they could actually become, a carrier, even if they are not. So it's very, very important for, for the entire patient to be tracked and to make sure that, they come back for treatment every month or every 3 months or 6 months, as the case may be. So we actually have proposed, usage of smart cards and the PHR and mobile phones with SMS, so that, and they're called peer communities, who actually get these, people back and make sure that they come back. So SMS is to the peer community with the location of the people, because unless you have this database, which is not there right now, you don't know, you just lose the patient. So this is something which, we are actively trying, and if it succeeds, I would really, this is an area where it's actually the use of tools in a very, very critical, scenario in the healthcare. It's not for urban, not for rural, but it's actually for a disease that we really want to control.
And in the government, it's just not, it's basically, and we need to integrate all these various departments operating in the health sector. It's not only health department. For example, IT will be part of it, animal husbandry, or all these things are part of the entire health system. So we need to have a platform which will talk to each other and have a common kind of approach towards meeting all these demands of the rural areas. And I don't see, taking a long time. It's only a matter of time that this will all happen.